Assalamualaikum everyone, welcome back to my YouTube channel. In this video we will talk about malabsorption. As the name indicate, absorption will be improper due to many reasons. What will be the reasons? What is actually location where malabsorption occur, etc. will be discussed in this video, so don't miss any part of the video. The inadequate transport of one or more of the constituents of the normal diet from the intestinal lumen across the intestinal epithelium into the portal circulation is called malabsorption. So first of all, let's understand the definition of the malabsorption. There is inadequate transport of constituent in the form of diet which we intake in the form of food. These are constituents of the normal diet which are inadequately transported from intestinal lumen into portal circulation, because all these nutrients which we intake in the form of food, liquid, solid, etc. will reach toward the portal circulation via the intestinal lumen across the intestinal epithelium. When there is any of issue in the intestinal lumen or intestinal epithelium or inadequate transport occur, as a result malabsorption occur, because when the food don't reach the portal circulation adequately, it can't absorb it, so malabsorption occurs. The site of the nutrient absorption are given below, which are duodenum and ileum. Iron, calcium, magnesium, folic acid, water, soluble vitamins, amino acid and monosaccharides are in the duodenum, while in the duodenum we will talk about the fatty acid, amino acid, monosaccharide and water soluble vitamins. Ileum, monosaccharide, fatty acid, amino acid, fat soluble vitamins A, D, E, K, vitamin B12 and conjugated bile salts. Physiology of the nutrients absorption is three phases. First one is luminal phases, characterized by hydrolysis and solubilization of the nutrients. Mucosal phase consists of the further breakdown of the nutrients and transfer into the cells. Transport phase consists of the removal of the nutrients into the vascular or lymphatic circulation. Then intraluminal phase, which is known as digestive phase. Dietary fats, proteins and carbohydrates are hydrolyzed and solubilized by the pancreatic and biliary secretions. Fats are broken down by pancreatic lipase to monoglycerides and fatty acids that form the micelles with the bile salts. Vesicles are important for the solubilization and absorption of the fat soluble vitamins A, D, E and K. Proteins are hydrolyzed by the pancreatic proteases 2 and di and tripeptides and amino acid. Carbohydrates are degraded into oligosaccharides. Pancreatic insufficiency may be due to the chronic pancreatitis. Decreased bile salt concentration may be due to the biliary obstruction. Cholestatic liver disease, bacterial overgrowth leading to the bile salt deconjugation or decreased reabsorption due to the ileal disease such as Crohn's disease. Mucosal phase. Mucosal impairment is the most common cause of malabsorption. The mucosal phase requires a sufficient surface area of intact small intestine epithelium. Brush border enzymes are important in the hydrolysis of the disaccharides and di and tripeptides. Malabsorption of the specific nutrients may occur as a result of the deficiency in an isolated brush border enzyme such as lactase deficiency. Mucosa may be impaired due to the disease of the small intestine such as celiac disease or Crohn's disease. Transport phase. After absorption, nutrients leave the cell through the vascular or lymphatic circulation require the intact lymphatic system. Obstruction of the lymphatic result in the impaired absorption of the chylomicrons or lipoprotein result in the steatorrhea. Classification of malabsorption is given below. Due to pancreatic insufficiency due to the deficiency of the bile acid, and third one is on the basis of uncoordinated gastric emptying. If the gastric emptying is incoordinated, gastroenterostomy and partial gastrectomy can be occur, and bile acid deficiency, interruption of the enterocephalic circulation, colonization of the small intestine and stagnant lobe syndrome can occur. Disorders of the mucosal phase are also discussed in this table. You can see it there. If you have any problem regarding the topic, you can ask me in comment section. Thank you so much for watching the video.